So welcome to the video that's going to look at some of the core sections of the NIPAD. We're starting here with the cover page of the NIPAD where the student completes their details, and you'll see from the logos that the NIPAD has been used across all three universities in Northern Ireland. So that's Queen's University, the Open University and Ulster University. At the bottom of the screen you'll see the instruction that students should bring their NIPAD with them to each day of their practice learning experience, so that practice assessors, supervisors and academic assessors can see what evidence has already been developed, but it also enables them to record and get authentication of evidence as they go along through each day of practice learning. In addition to that, students are asked to bring their practice learning handbook, the NIPAD handbook, with them. The NIPAD handbook has all the instructions in much more detail around the NIPAD, and it also governs some aspects of practice learning around attendance, uniform, etc. So there's a lot of supporting information in there for students and for those supporting them in practice. So you'll see in the first sections of the NIPAD document that it gives some guidance for the use of the NIPAD, and you will see that largely the NIPAD is separated into two sections. The records of discussions and the evidence of learning and achievement are in section 1, and then section 2 really is the assessment component. So the NIPAD is a document that not just sets out the learning that the student should engage with through the types of evidence that have to be developed and authenticated, but it collects that evidence up and then informs the assessment process. So section 1, as I said, is around the records of discussions, and those records of discussions take place over each practice learning experience, and the evidence of learning and achievement is developed throughout the part of the programme, which is generally a year. And so you will see there are separate videos that will go through those components. In this section of the NIPAD you'll also see just a summary of the types of evidence that are developed and authenticated, and that includes things like professional values and practice, communication and relationship management skills, promoting health and preventing ill health evidence, leading and coordinating care evidence, reflections and care documentation. There's a significant component around health numeracy and calculations of medicines, particularly as the pre-registration programs now are responsible for preparing students to a higher level in terms of medications, so that they can effectively step onto prescribing programs once they register. There's evidence around quality improvement in practice, the service user care feedback process, and then there are specific worksheets, and this will be different in the different fields of practice, but there's one for children's across the adult, mental health and learning disability fields, and there's one for learning disability that's in mental health, adult and children's nursing fields of practice. There are other documents to be completed that will include things like signature logs, which we'll look at in a moment, and then in additional records we'll find templates for managing the record of underperformance. There's also a record of attendance, and this is very important that this is accurate so that students meet the NMC requirements for registration. And then there are places for practice supervisors and assessors and academic assessors to make additional notes should they feel that it's necessary to do that. There's also a record of learning with other healthcare professionals, so that we can record time spent with other professionals where valuable learning can take place. You'll see then in the next sections that the NIPAD will discuss just an overview of the ongoing record of achievement, and it sets out some work that should be done prior to practice learning, where the students will attend their preparation for practice programs, and they will complete their personal profiles, they will make contact with the practice setting to prepare for attending as scheduled, and they will obtain any relevant information to support their preparation for practice. Prior to the student coming, the nominated person will identify the nominated practice assessor, and that will be notified to the universities in advance, and they'll also allocate practice supervisor or supervisors in the area that the student will be notified of when they arrive or when they phone up to make contact. Additionally, prior to practice, the practice supervisor and the practice assessor, they will make preparation for the student coming. Once the student commence practice learning, then they need to have their orientation, and the student should complete their orientation checklist with a member of staff. So in the initial discussion, which should take place within the first week, the student and the practice assessor will look at the learning and development needs of the student. Those will be agreed, and there will be a plan set in place for the student to achieve those. Moving forward within the practice learning experience, there will be a progress review, and this occurs midway through the experience. So for example, the student may be on a 6-week placement, and then the progress review would occur around the end of week 3. And again, this progress review is undertaken by the student and the practice assessor, and at this point they will complete the professional values in practice template, and they will look at progress in terms of learning and development needs and identify any future development that needs to take place. The final discussion happens at the end of the experience and again occurs with the student and the practice assessor. Again, the professional values and practice templates completed. Again, progress and achievement are explored and documented, and then a plan for the next practice learning experience is put in place. Now, sometimes students feel that that plan means that they have deficits. However, there should always be a plan for future learning. In terms of assessment and practice, then, this section really just identifies that throughout the different parts of the programme that skills development and proficiency development is incremental in nature, that it's a scaffolding approach to education. So in part 1, students have guided participation in care, and they're performing with increasing confidence and competence, and they're applying knowledge, skills and professional attributes. In part 2, we want to see active participation in care and decision making, and performing with increased confidence and competence where they apply that knowledge, skills and professional attributes. In part 3, students should be practicing autonomously with minimal supervision and leading and coordinating care competently and confidently, and that needs to take place within changing environments where they again apply knowledge, skills and professional attributes. Now, the assessment strategy across the programme is that a tripartite formative assessment will occur midway through the number of practice learning weeks within the part of the programme. So for example, if there are 20 weeks of practice learning in part 1 of the programme, that tripartite formative assessment will occur with the student, the practice assessor and the link lecturer or the practice tutor around the end of week 10 roughly. So there's some flexibility there. And then the summative assessment occurs towards the end of the final practice learning experience for that part, and it must provide for a 2-week period where the student can make good on any deficits and have a second attempt, and that occurs with the student and the practice assessor and also the academic assessor, who generally is the link lecturer or practice tutor. Now, in this first parts of the NIPAD, you will see that it starts out with providing a personal profile around the student, and this is very important for the students to complete because it gives really a pen picture of that student in terms of their background, whether they're entirely new to caring, whether they have been in a caring role for a number of years and so they have to have a shift in their focus in terms of being preparing as a nurse, but also to look at the students' aspirations, and it is intended to help practice supervisors, practice assessors and academic assessors to get a feel for who that student is as a person, as we try to take forward and role model a person-centered approach to practice. It's important that in education we also take a student-led approach as well. Then you'll see in the beginning parts there is also a signature log that must be completed. So anybody who makes any entry into the NIPAD must complete the signature log. So this concludes the first of the videos going through the actual NIPAD itself. It's now time to proceed to the next video, which looks at the records of discussion and feedback. Thank you.